Dr. Kourakin, tell us, what, sleep apnea has to do with a dentist. We keep hearing in the news lately. In fact, I think in your state, in the state of New Jersey, not too long time ago, a bus driver wrapped a bus around a bowl and killed some people, and they suspect sleep apnea. And overall, the medical field has found in the last half a decade or whatever, they always have known about sleep apnea, but they start realizing that so many people who A, snore, who B, need that pickup drink in the afternoon, that espresso, that Red Bull, that Coca-Cola, that energy bar. We keep thinking we have less energy. Well, we do. But we do because we didn't sleep at night because of sleep apnea. So I got all that, and I'm not so sure people get it because it's a rather new kind of like, wow, that's why you're tired, you're not sleeping. But what does a dentist have to do with it? Shed some light on it.
Well, for instance, a dentist needs to evaluate several things. First of all, the correlation between people that are grinding their teeth in their sleep and the people that have a problem with actual sleep apnea. Because quite often it's a combination of the two entities, the two problems that create the issue of not having enough sleep. Because we have a very disjointed, a very disruptive sleep if we are clenching our teeth throughout our sleep. Quite often patients will actually wake themselves up, even subconsciously. They may not be awake, or not consciously they're awake, but subconsciously they are awake just from the grinding of the teeth. So it's not just about the breathing pattern. But if we see, for instance, that a patient has a constricted palate or a uvula, that's that little projection that hangs down in the back of our throat here, that it is too large, too long, the palate is too constricted so that there's enough air passing through the sinus passages, enlarged tonsils in children. And my God, I see too many of that where we need to address the problem with the parents, address the problems with the individuals that do even have enlarged tonsils or anatomical structures there that we know are going to put them at risk to sleep apnea. And as I said, in conjunction with a TMJ grinding habit. So that's something that we are very versed in, and we do study our patients, and we try to ascertain from them whether they do have problems with sleeping. Quite often we actually can see the damage in their teeth from the fillings and the markings in the fillings.
Okay, so obviously, you explained very well that you have many ways and ways of diagnosing and how it is connected with all here, the tongue falling back, all that type of stuff. So, which may bring snoring and or not sleeping, waking up. Sometimes, I don't know, I heard as much as 100 times an hour or something like that, enormously a lot. So, obviously, sleep deprivation is a bad thing. People get, it's just a bad thing. But how do you fix it as a dentist? How does a dentist fix it? Because from what I know and heard, the CPAP machine, which is, boosts oxygen into your thing, and you put that mask on, it look like an alien, is the golden standard. So where does a dentist come in? How do you fix it?
Well, here's what a dentist will do. There is an appliance that we can create for the patient. Each appliance has to be custom fabricated. Each appliance needs to consider, we need to consider exactly what are the limiting parameters to the patient. Is it, as you said, the falling of the tongue? Is it the cheeks? Is it the bite? Is it the extension of the lower jaw? How do we position the jaw so that we're going to allow the patient to keep that passage open so they can get the necessary oxygen and keep the throat area from closing? And once again, and quite often this has been an issue with a CPAP machine, the bite guard will keep the mouth open, and quite often it's not necessary to have a CPAP machine as long as you're wearing a bite guard that's been constructed in such a way so that we do have the opening so that we can get enough oxygen in through the mouth and through the nose.
So is that that night guard which one wears and which is, correctly structured so that it, doesn't make the tongue fall back and whatever it might be. So now the person can sleep through the night. Is it kind of pretty much as good as the CPAP machine, or a little bit not so? And mainly that, is it more comfortable? Because definitely, talking to lots of people who have tried a CPAP machine, if their sleep apnea isn't so bad that the doctor tells them you don't wear it and you die, they seem to be quite often not wearing it simply because it's so cumbersome. Or they travel a fair amount, and yes, you can take them with, but we know that this days logging a laptop around isn't all that comfy anymore. We think it's too much. So having that thing around must be very complicated, and people, again, they don't do it. And I have heard that with sleep apnea, it's a little bit like with reading glasses. Like, I need reading glasses. If I need to see everything on my computer perfectly, I need to put those glasses on. When I have them on, I see perfect. When I take them off, it's fuzzy. And I heard that with sleep apnea, it's a little bit the same way. You have your machine or whatever it is on at night. You wake up accelerated, you wake up full of energy, restful asleep. You don't have it, you don't. It's just that simple. So you need it all the time. So give us some of the pros and cons of both of the things, the CPAP machine and the night guard.
The CPAP machine is far more bulky. There's no question about that. It's an externally worn device. It is cumbersome. It is difficult to transport if you are on the road in any way, shape, or form. A bruxism appliance, one that's designed to allow you to breathe easier, is a small appliance. Yes, it's intraorally constructed. However, the patients tell me that where these devices, the ones that truly need these devices there, actually will say to me, George, I actually feel naked if I do not have my appliance with me. It feels like there's a part of me that's missing there, that I don't have the support in my jaws and in my teeth, that things are closing down on me. This actually gives me the sense of things being open. So although one is in the mouth here, I personally have found that patients are far more compliant in wearing a bruxism appliance designed as a sleep apnea product than a CPAP machine. And I also believe that the cost is significantly less with a dental appliance than a CPAP machine. I'm not saying that CPAP machines, well, I am saying that there is a place for CPAP machines, and quite often we have patients that actually wear both because there is so many different issues, and that individual has to simply understand that it's going to take two appliances to really aid them with their problem.
So should a person, so let's just assume there's a person who he knows he snores because his spouse tells him so. He might or might not know that he stops breathing because his spouse might or might not tell him, and he probably doesn't notice it himself. You know what I mean?
Yes.
But in any case, he definitely wakes up just a little bit less rested than he thinks he should after a good night's sleep, and he definitely feels in the afternoon like he's like knocking out. Because they do say in the medical service that more people have very bad car accidents from sleep apnea than from drunk driving, because the sleep apnea people just totally pass out. They just go over the cliff. The drunk guy, at least in the last minute, he tries to get back to the road. But in any case, so if a person has those symptoms, should he just go to a dentist, and can you fully evaluate him, or does he need to have one of those sleep tests where he, stays in some place at night and gets tested? What's your recommendation there?
My recommendation is absolutely both need to be performed. And whether the person starts with sleep studies or whether the person starts with the dentistry, sometimes it's 50 of one, half a dozen of the other. But they do need to absolutely consider both fields of expertise in evaluating their specific problem.
Good. All right. And, because if a person, for instance, goes to a dentist, gets one of those appliances, and obviously he wants to get the best out. He needs to make sure that he gets the best. But at the very worst, he probably will stop snoring to quite a high degree, right?
Absolutely. He will stop snoring to a significant degree. And modifications with a dental appliance can always be made, as opposed to a CPAP machine. They're not going to be very easily modified. However, with an appliance such as what we make, these are acrylic devices that can be changed quite radically, changing the position of the tongue, changing the position of the bite, the angle of the opening, how people's mouths move, and the jaw moves there. So that is something that can actually evolve as his sleep studies go on, and as he actually goes on with his wearing of one or both of these appliances there. So we do actually follow the patient for a considerable period of time and getting their input back as to how they're performing.
Well, in any case, so now dentist can save you $3-4 on Red Bull drink every afternoon, and you're on top of it feel naturally high. That would be the new headline out there in the New York Times, I guess, soon. Should be probably, right?
Yes, absolutely.
Thank you very much, Dr. Kourakin.
Thank you, Helen.